diabetes from diabene. It's a Greek word, diabene. It means to pass through. So what is passing through? Many people coming with diabetes then, they pass a lot of urine. They get very thirsty, pass a lot of urine. So they were just like siphon. You drink water and then it passes out. Yeah. That's just the root word. But there are two types of diabetes generally. So there's the mellitus and then the insipidus. I'll explain. So mellitus, one type of diabetes, one dealing with sugar. Then the one by insipidus, you continue to pour out urine, but it doesn't have taste, no sugar involved. So there are two basic types of diabetes, one with sugar, one no sugar.
Okay, so what did they happen now for this type 5?
Type 5. When the child is developing right from the womb, we said that around week 4, the pancreas will start developing.
Yes.
By week 15 max, insulin will start getting produced. You can even detect it.
Yes.
Right? So those cells start appearing within the period where the pancreas is developing.
Yes.
Now, there is what we call hypertrophy and then hyperplasia. What it means is that enlarging in size or increasing in number. Now, the same thing, those cells, those beta cells, they undergo what we call hyperplasia. They increase in number over time so that they will meet the demand of insulin in an individual. So when you don't have sufficient nutrients, now these nutrients divided into two, they are macronutrients, the bigger ones, they're micro. Now, if you don't have those things sufficiently, proteins that the body breaks down to amino acid are the building blocks of the organs in our bodies. So which means if the mother doesn't eat well and the baby does not get enough of this thing, that building block is not sufficient to build the pancreas.
Welcome to another Ability Inside Disability podcast session. And today we are having a very, very interesting topic. In fact, the topic interested me so much, I decided to have a conversation with my team, and we decided that we will have this conversation because it affects our community. And the topic is type 5 diabetes. I mean, I was really, really surprised to hear that one, type 5. It is a nutrition-induced diabetes, which means this diabetes happens because the child does not get enough nutrients from the mother's womb and after delivery. So please join us, learn a lot from this conversation. We have an amazing doctor that will be doing justice to this topic, and afterwards share with everybody you know so we can live healthier lives and bring to this world healthier children. Come for this our podcast, Ability Inside Disability. Don't taste small. I know when I see my face, it doesn't taste small when I do this studio. But thank God, say all of us they here today. Today topic, a very, very deep topic.
Yes.
And then a topic will be very, very important because the reason why they cause this thing we want to talk so it's simple way. It's simple, but it's still hard. But we will start to say it's simple because it's common. And what will be the topic today? We want to talk about how type 5 now I talk about type 5 diabetes. That will be the new one where they bring come out now. How this type 5 diabetes feel cause maybe can get developmental disability, intellectual disability, or even learning disability. So, to talk this matter where everybody go take understand them, as you know, we always bring specialists come to our program because we want to get the information we need to take help on ourselves and help people around them. Mr. Ini, you know Mr. Ini now.
Yes, sir.
Our special educator, autism specialist, good boy. He dey here. They still there with us. So, Mr. Ini, greet our audience.
Correct people. And I welcome again. We don't go feel life for here. We don't miss on our way. And more than no verse. We don't go miss again.
Now our angel matter now will go out go do now. So now me all for better.
Yeah.
Now we the waka. So the Ogonga person we will bring call will be say now waiting in go school go learn be that. Dr. Kimto in the here with us, now he go help us understand this type of diabetes and how if it take cause developmental, learning, and intellectual disability for our children. Dr. Kinto, I beg, greet our people.
Hello, good day, everyone. Thank you for coming to watching our podcast. Thank you.
Okay, Dr. Kinto. We know say we never come our podcast before, so we understand. But relax.
Yeah.
Here, now relaxation place.
Yes,
you know
sir.
they do exam. We just they come here.
Take a
Exactly. Take a
jeje.
jeje. You know, now serious topic we dey talk, but we dey talk and with relax because for everything we would do, we must look for how we go take relax, enjoy am. Because if we were this today not enjoy, our people will they listen. Then to go enjoy.
Go out.
So, Dr. Kinto, make we enjoy this topic. Okay, so I go if I go ask the first question now so that you go they take the topics, they relax actually answer us. What will be this type 5 diabetes? What will be type 5 diabetes?
Okay, type 5 diabetes is one of the diabetes that just was accepted into medical field just last year.
Last year?
Yes, that was 2025. After International Diabetes Federation is in Congress in Bangkok, that's Thailand. So prior to last year, there's been some consensus about that diabetes, like from 1950, some doctors started observing something, an abnormal presentation that people like younger children will come in with diabetes, looking like type 1 diabetes. But one, they don't have some of those criteria, those things we pick to make diagnosis of type 1, like ketones in their urine, they don't have.
Okay, what is the ketones now?
Ketones, okay, these are some form of chemicals.
Chemical for inside
Yes, for
peace.
yes.
Okay.
That when someone has type 1 diabetes and is having crisis,
Okay.
you have it a lot in the pee.
Okay.
Because instead of the body using glucose, the body begins to break down fat. So it's a byproduct of fat. You see it in the urine. So it has this sweet smell. You can pick it by doing a test of the urine. You see the ketones, and the person breathes very sweet. We call it ketone breath. When you come close to the patient, you perceive it. But
like sweet.
Yes, but these children, they don't have those classic signs.
Okay, so for you to get type 1 diabetes,
yes,
your piece will be like what is sweet there inside. So ants go dey plenty when you piece that piece.
Exactly.
Then if you dey talk, the air where they come out, the breeze where they come out from inside your mouth, it will be like sweet.
Yes.
So for this type 5 now, you know show.
Yes.
So because of that one, they can't believe say this now another type.
Yes.
Even though you want resemble type 1, but not the type 1.
So initially there was that problem. So around 1985, the Diabetes Federation was like considering to bring it into like a diagnosis because they are not really sure. Then in 1999, they removed it. They said they don't have particular criteria that they should stand on and say this is a particular disease. It may just be a variation of type 1.
Okay.
So, but a woman came up in the 2005, Dr. Meredith Hawkins, an American doctor who picked interest. She's an endocrinologist, that's a doctor that deals with diabetes and other hormonal conditions. She picked interest and then started organized people and started research. That was like 5 years later. They made this thing, they call it the Global Diabetic Institute. It's located in Ensign School of Medicine in the US, actually New York. So they started research. By 12 years down the line, that was in 2022, the research now everything tallied and she was able to point out that this is a different
type of
diabetes, unlike the other diabetes, because there are lots of diabetes. So this is a particular diabetes, and this they will point out the cause, how it goes. This is why you treat like the other one, and the outcome are bad.
Does not work out.
Yes, it doesn't work out. So this is a different thing. So fast forward 3 years down the line, which is last year, they had a congress, the International Diabetes Federation in Bangkok, that's Thailand, and they decided that this is now a particular
type of
type
diabetes.
of diabetes.
So they decide for Thailand now, so we don't get what they call type 5 diabetes.
Yes. So
what did they cause this type 5 diabetes?
Okay. So the type 5 diabetes is caused majorly by malnutrition, either from when the baby is inside the womb.
Sorry. Can you repeat that question?
Okay, for this what did they say they cause this type 5 diabetes?
Okay, so type 5 diabetes, unlike other diabetes.
All right, just continue.
Unlike other diabetes, is caused by malnutrition. That's malnutrition in utero. That's when the baby is inside the womb. The mother is not taking in enough nutrients, food, maybe due to no socioeconomic status.
Yes.
Or when the child is born, poverty. From young age, childhood, adolescence, all that period.
No nutritious food.
The child is in a poor environment.
Doctor, if I understand what you talk now, you say they first discovered this thing since 1950 something, then they don't check out. Say this diabetes deal, but it's different from type 1 diabetes. Because they don't understand that fish they call liver. Nobody talk about that. After, for 1999, one woman, what they call Meredith, Abi, for US, come bring up this matter again. Say, oh yeah, this diabetes, so he don't they look and see so. Now, he don't understand, say, now true, say, not be type 1 diabetes, not be what they cause type 1, they cause this one. But the thing when they cause this one, they say, the mama not see food chop, rich when he get the pikin. And even when they don't born pikin finish, the family not see better food, they feed pikin till he can't reach the age where he say, that kind of thing no go fit affect pikin again. So all the time when the pikin really need good food to take grow, for him body to take develop, the pikin not see good food chop. Now, what it cause surprise for the pattern now be say, for this US, we all of this one for the happen so, they not get malnutrition problem. Us where they Africa. Now here no malnutrition day. Why you not be saying African man discover this?
This is a very interesting.
You understand what they talk? Because I still they talk just now. Just they mention Meredith, they mention US, they mention New York, they mention Bangkok.
Yeah.
And I know say all of these places they don't pass. Mama get pikin for belly, no seafood chop. We can't get that problem for this continent, sub-Sahara in particular, and Nigeria part of farm. I will get gastroenterologists that they research for here. Where endocrinologists. Why they not come see say now this poverty they cause some? Why not be saying a person from this country? What do you think, Doctor?
All right. So looking down, what happened was that most of the observations were coming from all these what we call LMICs, low and middle income countries, like the sub-Saharan Africa, comprising about 42 countries.
Plus Nigeria?
Yes, including Nigeria.
So we send all
our data and sample go outside.
No, we didn't send. Some doctors were picking it and reporting. Do you understand? Now we're seeing something, when in medicine,
they are reporting to New York.
Maybe when they have a congress or a conference or something, there's what we call a case report. So a case report means we see a new thing that doesn't tally with anything we know as doctors. This thing looks different. New. Let's write something about it. Have other people seen it in other places, or this is just the first case? Then we start researching into it. You understand? So countries have had sub-Saharan Africa and then Southeast Asia because of the poverty there. Doctors have observed some of these things and have heard their concerns out. But because the developed countries have not seen those kind of things, so they just feel maybe it's just a variation.
So, but why is Meredith the name that they are calling? Why is it not of Africa? No, it's very important to me because we are talking about, I know, say this podcast now about learning and intellectual disability, but we also need children, make them pick interest in researching about this matter. Because the truth be say, if we did this our country, for example, we not show interest. We not work with ourselves. I mean, with each other for this matter. We not go find solution from within our environment. And support go the deal. You understand what I talk to Ogasan?
I understand.
Because this type 5 diabetes now, it no concern Meredith and people like Meredith. It no concern them at all.
You know, as they ask this question now, I don't dey pity Dr. Kim because
that's how we grab
you get when this thing don't touch you, we don't invest in one kind.
You invest me. Invest me because when they talk say that affect by diabetes, now they cause poverty and no see future. The only area where they suffer that one. Now sub-Saharan Africa and Southeast Asia. But now, Meredith called they discover, and I said the same go back discover the river where you don't sit down. Why? Because we know they discover anything.
Yes, we do.
I don't ask Dr. Kim for just to say, what to make be say diabetes fine will be say they say now poverty and hunger the cause. And now Meredith now they call say discover now, discover what the cause. And Meredith now American. Why be say now people will be say now for their area they suffer that thing. Now you be Tunde, now you be Khan, now you be Chowdhury, all of these people from Southeast and all of us from Sub-Saharan Africa. Why not be saying now our name they mention say
now we discover
that because now these areas now poverty day now these areas we go expect researchers and all of these scientists, all of this, what do you call them with the doctor when they do this just like endocrinologists. They graduate them every day for this area. Why?
I've more than no verse. But he get waiting this guy, Abraham Maslow, where we develop one pyramid where they say hierarchy of human needs. For the down now, the very basic things where person need to survive: food, clothing, shelter. It verse why you say that marriage where they wear food.
Because I know
now they discover diabetes where poverty because. So they say who never job better food no get business
to
discover anything. So for the most part, we went to this side. Our major problem is to even find better food job, see clean water they drink. Find place where we even fit keep head.
It makes sense.
So this one now if he answer that question small.
No, yeah, that answer I like him too because as I asked before, because I know say if we make the efforts, if the support day, not be waiting our doctors. No. Because as Dr. Kim to talk just now, he said now from these areas, then therefore they send the data, the information, we'll give them for the US. Which means they know. Then too they observe what did they happen to these children where they get this condition, we say they don't observe them and they want to say, okay, this one poverty cause some more. The hunger
they
cause
never
some.
give a name
They
yet.
never give a name yet because they want to understand. The reason when they fear you not going to give a name, they say they don't get backing. Abi Dr. Kim to
and maybe the research never complete or it.
Yeah.
So what is your view for this one?
Yes. So for her, why she got that advantage was because one, she was traveling across some of these countries, doing some things, and then as a chairperson in her own field and one of the organizations she was chairing. She was getting this data from the countries and then the reports. And that was why she picked interest on starting up that institute, Global Diabetes Institute. And she had funding because funding is one of the key things to fuel research.
And we don't get that kind of funding for Africa. We don't that funding not the day available they had, have you?
It's difficult to find funding in a country or a continent where to even support healthcare is not there. Then why would they just give money to go and search for something? Do you understand?
And it's expensive.
Yes, research is quite expensive.
But research is needed.
It is
to build. Because we need research to tell know what they happen, so that we go fix this. Because sometimes this fund healthcare where would they talk? Like these people with the developmental disability now and learning disability where they happen because of hunger and poverty. If to say we they really put money for research, we go they make sure say the nutrition they are available. We go still save money for the healthcare. I mean, not be so. Because if you say money to go to you will not get money to do something because of healthcare expenses, you go spend up if you know the research. I mean, talking to.
It's true.
I mean, I like.
It's not like I told you. This thing, you get where the touch over body. Because
Because the thing don't hit me somewhere for inside my head. Say, why Meredith will be the one when they don't come off my mouth again? The thing vex me. Because you go, they get consultant in this, consultant in that, consultant in this for this hour. Oh, don't say this our Nigeria. For this Nigeria is with as a country be rich so. Nigerians still get brain rich to take do this to this woman do so. But because as you talk this now, the woman they travel around. The money they take they do all of this one.
Yeah, it's true.
So now see why it is important for government support. Now for this our program with the way they talk say. Now government be papa and grandfather for all of us we be Nigerians for this country. And we as family of people with learning, intellectual and developmental disabilities, we must contribute, we must participate for this matter. I dey studio now. This talk what they talk so they make my head hot small spot because I believe say our doctors feel be the one, our public health specialists feel be the one we suppose research this thing. No, I need to say that them do they get funding, they get support, they for don't do one since. You said they don't talk about this matter since 1950, waiting. Now 2025, then they can give a name. You know how many people they don't treat wrongly? You talk about just now. See that they treat them since as they treat type 1 diabetes patients. What it be type 1 diabetes?
Okay, so in type 1 diabetes, what happens is that the body, because in the body they are like, let me say, soldiers that help fight disease, right? Now, there are particular soldiers in the body meant to fight disease. They begin to destroy the pancreas, an organ that produce insulin. Insulin is a chemical that helps to mop up excessive sugar.
To clean sugar, come up for
Yes,
blood.
for blood. You understand? So now that organ that produces insulin gets destroyed by the body's own soldiers.
So the body go to fight body,
yes,
for inside.
Yes. So we call it autoimmune disease. So your body is destroying something inside. So when the body destroys this pancreas, the pancreas no more secretes that chemical. So sugar begins to pile up in the blood.
Inside the blood?
Yes, in the blood.
And that one they destroy the body, they go.
Yes. Unlike this poverty-induced diabetes.
This diabetes where people that poverty cause them. This one, a hunger cause them, not be say soldier they fight body.
Yes.
So you're gonna take medicine.
Yeah.
When you want to take kiss soldier for person where they hungry. That will not be death sentence for the person where they supposed to give food. Make condition improve.
Today when you be like in school when I come,
I'm telling you,
make a delay because now since we begin this year today, now type 1 and type 5, and this diabetes now you be like waiting. I don't know about diabetes now. You don't declare my clear my mind well because all my life I don't know say diabetes na sugar. Say sugar too much inside body. So we don't only talk about type 1 and we try expand on the type 5. So it means 2, 3, 4 still there. I beg for people like us we will be backbenchers that year. That year.
Which year be that?
You don't tell me well. I beg help us. I beg open this diabetes so make we feel understand.
But then sugar will not be sugar.
And the people where they follow watch us.
Okay. So let me just say something about that word diabetes. Because most times when people hear diabetes, the first thing that comes to mind is sugar. You understand? But early in the centuries, from the ancient Greek,
Mm.
there was this this Greek doctor known as Apollonius.
Mm.
They call him Apollonius of Memphis. He was the first person that coined that word diabetes from diabenet. It's a Greek word, diabenet. It means to pass through. It doesn't really make sense now, but when I explain it to you, so what is passing through? Many people coming with diabetes then, they pass a lot of urine. They get very thirsty, pass a lot of urine. So they were just like siphon. You drink water and then it passes out.
Yeah.
So that's the word, diabetes. So diabetes, you understand? That's like passing through like a siphon. Because they come every time passing urine. They are very thirsty. They drink water, they pass urine. Drink water, pass urine. So that's just the root word. But there are two types of diabetes generally. So there's the mellitus and then the insipidus. I'll explain. So mellitus was coined from the word mel by a British physician known as Thomas Wallis. That was in around the 17th century, exactly around 1675. He coined it mel from Latin word honey. So mellitus, honey, like honey sweetened or sweetened by honey. So that's one type of diabetes, one dealing with sugar. Then the one by insipidus was by a German physician known as Johann Peter Frank. That one just got his own in 18th century. He named it from a Latin word insipere. Insipere means tasteless or without flavor. So that's the second type of diabetes. You continue to pour out urine, but it doesn't have taste, no sugar involved. So there are two basic types of diabetes, one with sugar, one no sugar.
Oh.
Do you understand? So that word diabetes doesn't equate to sugar. It's just equating to what is happening, that is passing through. Water is passing through. That's just what it is. But when you qualify it as diabetes mellitus, it becomes the one with sugar. Then there's insipidus, the one without sugar. But all of them pass a lot of urine. So when we come to mellitus, insipidus has its own type. Mellitus has its own type. So we have the type 1, type 2, type 3C, type 3, type 4, type 5, and even type C, that is research or theoretical, type 6. I mean, you understand? So the type 1, what happens there is that someone is giving birth to, because of that, we call it autoimmune disease. The body soldier comes to destroy that pancreas. Pancreas is an organ.
Right from inside the stomach, right from birth.
It could start, or even because pancreas begins to develop 4 weeks when a child is developing in his mother's womb. Yes, so that organ begins to develop. By week 10 to 15, they start producing insulin.
Okay, what did they make those soldiers? They come. What did they bring the soldiers come inside the body?
So sometimes there are lots of things. It could be genetic. It could just be like something just triggers mutation or something. So they just come up and begin to
start to be destroying. They destroy the pancreas.
That particular cells that produce insulin. We call it beta cells of the islets of Langerhans. Sorry for the long name. But those cells, they produce insulin. So those soldiers begin to destroy them so that there are a time will come when there's either no insulin or very little insulin that would not be sufficient enough to mop up excessive sugar in the blood. So that's type 1. Before it was known as insulin dependent, right? Diabetes.
Yes.
Then in type 2, it has nothing to do with the body destroying itself. So in type 2, what happens is that it's just that over time, because of probably for some people excessive eating. So when you eat a lot of carbs and all these refined sugar, yes,
and you know they soak Gary City.
So Gary with sugar. So Gary with sugar.
So it begins to stimulate insulin, because when sugar is a lot in the blood, insulin is stimulated. Then that beta cells in the pancreas gets stimulated. It produces insulin. So because it comes, it's just like a door, like the door handle. Yeah. Insulin comes to the door, open the door, and then glucose will enter into the cell and it will close it. Just something like that in a very simple term. So because it happens frequently, the door becomes worn out. It's no more responsive to opening the distance. So it just locks itself. So it's as if it's resistant to the insulin. They are worn out.
So the sugar will not be too much in the blood.
You understand? So in that context, there's insulin. Unlike in type 1 where there's no insulin because of destruction, In type 2, there is insulin enough, but the
The
receptors,
lifestyle
yes,
and the overeating of
eating and
what you're
all.
not supposed to be eating
Yes.
has
So
now
over
destroyed.
time, yes,
over
they
time
get
destroy
down
the cells.
regulated. They stop responding to the insulin.
Okay, so what did they happen now for
Then
this
in
type
type-
5?
Okay.
Type 5. So,
So-
what would they talk about today? So,
Yeah. So in type 5, when the child is developing right from the womb, we said that around week 4,
yes,
the pancreas will start developing.
yes,
By week 15 max, insulin will start getting produced. You can even
Yes.
detect it,
yes,
right? So those cells start appearing within the period where the pancreas is developing.
yes.
Now, there is what we call, I will explain the term, hypertrophy and then hyperplasia. What it means is that enlarging in size or increasing in number. So
Okay.
growth can happen in two ways, whether something is enlarging on its own or the components are increasing in number, then it also, you understand?
Mhm.
Now, the same thing, those cells, those beta cells, they undergo what we call hyperplasia. They increase in number over time so that they will meet the demand of insulin in an individual. So
Okay.
when you don't have sufficient nutrients,
Mm.
now these nutrients divided into two, they are macronutrients, the bigger ones, they're micro. The macronutrients where we have glucose, amino acids, fatty acids, from protein, carbohydrates, fat and oil, right? Now, if you don't have those things sufficiently, proteins that the body breaks down to amino acid are the building blocks of the organs in our bodies. So which means if the mother doesn't eat well and the baby does not get enough of this thing, that building block is not sufficient to build
that
baby. Yes, the pancreas
of the baby.
Yes, you understand. So, and those cells will not be built to sufficient number. So it all depends on what stage that malnutrition is happening, be it in utero, within the womb, or in childhood. Because the pancreas keep on growing, developing until adolescent age.
Which means if the mama not see enough food chop, we get nutrient for the pikin, your condition will worse as well when they don't born. We see food chop, but you not going to see continuous food chop.
So it all depends on the mother's own pancreas may have reached adults this thing, right? Before she went into poverty for whatsoever reason. So her own, she may have escaped this particular thing. But for the child, yes, it could be a child that from in utero has been exposed to this insufficient nutrients. So one, there is no building block to build the pancreas.
No enough protein to build the block,
build
for building block to help build the pancreas.
And then the glucose, which is from carbohydrate, it produces energy to help with this process of building. But the child doesn't also have this energy to help in the formation. Also, the more the cells, that's the pancreas, is getting exposed to glucose, those beta cells that produce insulin are also getting produced to meet up with the need on ground. But this child is not getting carbohydrate. So there's no need to also produce more. There's no demand. Do you understand? So you now have a child that is born maybe underweight, a child that is growing but stunted, low weight, which also is very small pancreas, producing very little amount of insulin that is not sufficient to keep this child to help with mopping up the sugar. And one of the issues is that in these low and middle income countries, one of our staple food, our common food is carbohydrate.
I don't near that place.
You understand?
Yes,
So that now the child is now eating morning, afternoon, and carbohydrate, but no insulin to mop up. So that's where the diabetes comes, because it's persistent elevated sugar in the blood. That's all.
So since pikin not get enough protein to take you the pancreas from your mama when the day inside belle, it come out now pancreas not form well. It come out now so carbohydrate in the chop. Pancreas not form well. It not get enough insulin. We go they clean the sugar where the carbohydrates they form.
Exactly.
All the time when they chop carbohydrates. So as it's only not fit clean them come out from blood. This people will get diabetes. So how this one they fit cause developmental, intellectual, or learning disability?
Okay, so sugar is very important. I mean, glucose. I'm just calling sugar, right?
Yes, it's glucose.
Glucose is very important. Just look at the brain. The brain is about 90 to 100 grams, very small. It's a fraction of the whole body, right? The brain matter itself, yes. So, but just imagine, for every oxygen you take, 20% of it the brain uses. Imagine just a fraction of the body, but that's how much it uses because it's an obligate oxygen user and then an obligate glucose user, which means it doesn't have an alternative. Unlike other organs in the body.
So compulsory must use oxygen, compulsory must use glucose.
So glucose as well, about 20 to 25% of glucose at every time T in the body the brain uses. That's how much it relies on glucose and then oxygen. Now, that's why if you don't have enough glucose or oxygen, in few minutes, the brain will shut down. You lose consciousness. But the heart can continue to beat because it can change its energy source to maybe fat or something else and keep alive. The muscle can change energy source and continue. It's just like when demands are high, athletes, you are running. So the muscle is using sugar, is using oxygen. A time will come when it will get exhausted. It will shift to what we call pyruvic acid pathway and start using fat.
Okay.
But once it starts using fat, the byproduct lactic acid gets accumulated and it pulls. So you have muscle pull and you go down. You understand? Because your demand for glucose, all those nutrients are now higher than the supply. Do you understand? So now in the brain, you don't have those sufficient carbohydrates, the energy that helps to both build the number of cells
that the brain needs.
Because the brain keeps developing up to like 4 to 7 years before it gets to roughly an adult size. That's why you see children, their head is a bit bigger proportional to the body. Because at that point, the brain is now like the adult size. When you give birth to a child, you see some fontanelle here. There are two behind you and then one lambdoid here, right? It's allowing for the brain to expand. Once that thing closes up, no more expansion. And that's why for children who those fontanelles close up early, they come with small head and learning disability, reduced intellectual capacity. Do you understand? Because intellectual capacity has a lot to do with the size of the brain.
That's what most go for,
right?
What the reason is people will get big head now.
People will get big head now. They don't look well with that.
It's not like that.
Some people will get big head.
That's it. Make some find trouble.
They will get big head. And I don't put pass on. With our brain strong well.
It's not in all cases. So there's what we call hydrocephalus.
Then water days.
Water days.
Enough big head.
Water days.
The cognitive function is not
I mean, what do they talk? What do they talk? They say we where the brain take the function, not be the size of the head. If it quick close, it not go give chance for the brain to expand, to grow as it want grow. You understand? But if it close normally as it's supposed close, the brain go grow the way it's supposed grow, it go strong and it go fit do the work we're supposed to. But the brain need plenty glucose. You need plenty glucose and oxygen. And if the pancreas now, where they manage all of this one, it not develop well. It's either it go get too much or it not go get enough.
Yes. So one this thing we call diabetes. There's something we say when we're dealing with diabetes. Like a maxim, we say diabetes is starvation in the midst of plenty. The blood has a lot of sugar, but the body is not using it. Do you understand? Because insulin either is not being produced or the receptors are not responsive to utilize this glucose. So in the context of our poverty-induced diabetes, now there are no enough insulin to drive this glucose into the
cells that so that the brain will now take from there to you.
Yes, and because the brain depends on every other organ, the liver, the kidneys, and all that. Even those organs are not
well developed because of lack of nutrition.
Yes,
it's right from the intro all the way to
exactly. So they are not well developed now, which means they will not function optimally. So let's take for instance, organs that help to detox, to remove byproducts and all that. They will not function well, and this thing will accumulate in the body, going to the brain and all that, causing abuse. Do you understand? So it's a lot of things all together that one organ can affect. That's one thing can affect the function of all other organs.
Result to intellectual, developmental, and learning disability.
Because there will be an assault or an insult to the
so brain. Now because there was nutrition, food not rich. I mean nutritious food will get the nutrients the pikin need. You not get them when mama get them for belly. They not continue to get them after they don't born her. Not be only pancreas, no go form well.
Yes.
All of the other organs, liver, kidney,
adrenal glands,
all of them no go form well. Even the gut, the digestive system, all no go form well. So that not be only the glucose where brain need a problem now, even the dirty where body supposed to carry come out. If you not carry and come out well, that one too go still carry dirty go brain. We're not supposed to go brain.
Exactly. It's just like in the case of
it not will cause pain for the picking body.
Yeah, so some of these things, over time, there's a way the body compensates and just the child is just there growing, but things are happening. You understand? That's why most of them they could come unconscious.
Seizure.
Yes, or seizure, unconscious.
Now wait for the brain, the brain to manage all of the excesses.
So it's now for you to make the appropriate diagnosis. And most times when people come, that's why when people come in unconscious, one of the first things we do, we check the blood sugar. Is it too much or too low? It could lead a child to unconsciousness. You understand? So most times when we just see it's too low, you just give them a shot of bottles and they will revive. You would think they were joking, initially, but that thing can lead them to death. You understand? One of my consultants had told us a story then that there was an experience he had. He felt like a god that day. So he was a house officer, like this new doctor. So he was in the emergency that day. So Hausa people rushed in one of their patients that, hey, he's dead. Please, they should check him. Because once it's confirmed dead, they will bury that day.
Yes.
So he just came and saw the guy. He checked random blood sugar and he saw that it's hypoglycemia. He just walked, brought 20% or so of dextrose, took 10 mils, came and sideline, immediately injected. The guy just revived to life. And he started shouting, this doctor has resurrected him. He said he started walking and he was bouncing. He said,
that's the power of knowledge.
He knew what he did. So, but that's how it works. Both ways, it could lead to unconsciousness and even death. You understand?
And destruction of the brain, especially in children.
Yes, in children. So, in newborn babies, we are very keen. When you are delivering a baby, one of the major things you are looking out for, the oxygen saturation of this baby. It's a very important factor you look out for. That's why we do Apgar score to look at this baby. What's the color? Is this baby pink? Is this baby active? Is this baby crying? And all that. We want to look at that. Because once a baby is born, that's why again you see that we want the baby to cry.
Yes.
Because once the baby cries, some things change within the heart and the lungs. The lungs open up so that air begins to enter.
Force.
Yes. Because in the womb, the baby does not breathe. You understand? They take up their oxygen and nutrient from the
umbilical cord.
So now, if a baby is not getting oxygen immediately, good amount of time passes by, there will be an injury to the brain. And this baby can come with things like even cerebral palsy. The same thing if there's bilirubin, bilirubin, like yellow jaundice. There's an amount of bile that can cross into the brain and destroy some of the brain cells. We'll call it bilirubin encephalopathy. Destroys And then this baby can come with learning disability, developmental disability,
Disability.
or some of them even die in the process, depending on the severity, because their class is type 1, type 2, type 3.
Yeah.
You understand? So we're very keen when it comes to baby. Any little thing can tilt them to the other.
So that's
Yes, to the other side. So that's why this this particular diagnosis is very important.
it's very important.
You know, when
I'm hearing now.
when I
Food
got
get
to
power.
know, yeah, because the first medicine you have is your food, right? Eating your balanced diet and all that, you don't really need a lot of things. That's sufficient to keep everything going. It's the fuel you need, the building block, the everything you need. But once you are not getting good food, it becomes a problem. That's when you will now need either medications or supplements to augment. You understand? Now, when I got to know this diabetes type 5, which is the malnutrition related diabetes, my mind went back to school. I've seen cases like that, but we didn't know what it was. We took it as diabetes type 1. So what happened? You know, as students then, mostly as students, when patients in pediatrics, when patients come in and then they test the sugar is very high, you start saying, no, this should be diabetic coma, DKA, diabetic ketoacidosis. They will give us urine, take urine and do urinalysis. So what we are looking for in that urinalysis is that ketone bodies.
Oh, you don't find ketone.
Because that will be what we make the diagnosis, DKA, that ketosis, diabetic ketoacidosis. That's what we confirm. When we go as students, we do our urinalysis, we won't see ketones. We will now report it negative. The senior colleague or doctor will come and collect it. You mean someone come with DK and there's no ketone? Are you people okay? You don't even know how to do urinalysis at this your age? Then we'll now go back. We'll do it again. Even if it's negative, we'll now put +1 so that we will save ourselves. Do you understand? We will save ourselves because that's what we're taught. You can't have DK without ketones. So which means they can even start saying that even if they come and try it themselves and it's still negative, they'll say, look at you people with using expired things. They will just label it as expired, or do you understand? So nobody's man was going to anything.
This is what they talk about research.
I remember a lot of
the power of research. The power of make everybody heads not day one place.
It's true.
See, the power of it's okay for you to question something. You know, this environment say, now as I want and I saw it must be, they drag everybody go back. Imagine just one senior doctor say, really? Try it again. Really? Try it again. You try it 3 times. You can say, okay, fine. As it be so, we go write this one down. Make I go check. Make I go read more. You understand what I talk? So see, this is why that make they important. See what I talk just now. Say why they talk for this program. Say us, family of children with learning, intellectual, and developmental disabilities. If we not all of us not become advocates, teachers, caregivers, supporters of our children, nobody go feel help us. It's just clear that now you go fight your fight. If the medical community true fight this fight, now Nigerian name go there that thing now. Forget funding, forget this one. When you dey passionate about something, you go welcome me the person we go listen to. It not go be only Meredith, it go be Meredith and one sub-Saharan African name.
There's an Indian.
Or one Indian man name or one Bangladeshi name. But you not go be only Meredith. Because as Meredith get passion, now so these people from this part of the world too get passion. But just because the book say na so, it just be like our children now. People they read book, but we learn how to take care of them from them. Have you had a lie, Mr.
No, we lie at all.
Because book could tell you something, but the pikin he get gene from papa, from mama, from inside family. My gene and my husband gene and our family gene. There's a which book? You know there's any book now. So I go to see character from inside family. So I go separate that for character from autism. They can't know where I go put down.
You know, so this one not from your house.
This is not from my house. This is not be autism. So you understand?
I understand.
Because now only when we they participate, we they allow ourselves to the question, to they believe, Say, what we see, now we true see. Even if everybody talks, say we not see, but we not say we see, and now we see, and we fight for what we see. That is the only time we say God be okay for our own matter. Otherwise, I say they go to hold our nose, they drag us, we go everywhere. Mary go talk, Charles go talk, this go talk. About our matter.
Okay, I beg. Go first.
So just two things briefly. So she has a co-chair. That's Nahil Thomas. Dr. Nahil Thomas is an Indian endocrinologist.
So why in name not Jonah?
So they are two, but she's the boss, so her name will be projected, right?
Yeah, leave that thing.
And then about grants for research, let me just say this here, right? There are a lot of grants out there that are lying fallow. Maybe, you need to bring an interesting research topic, prove it that this thing is worth it. Then you write a proposal and all, they give you the grants. There are lots of grants, billions of dollars. There was this professor in Drexel University, I wanted to do research associate for her. By that time, 3 years ago, she had won from 1992 till 2003. She has won grants of worth more than $1.something billion. So there are lots of grants.
Which university you call her? Drexel
in the US.
Where Drexel?
In the US.
Now they talk.
So
don't you even understand what
I'm coming. Let me drop.
Okay.
Now, there are some few persons in our environment that have gotten grants.
Okay.
Do you understand? But the first thing they come when they get that huge amount of money, they want to survey which color of car and which type of car is not in this environment. They now start feeding their own unnecessary maybe wants and desires before they
go close the door.
The research.
Close the door and everybody.
And once you can't account for, the truth is that when they give you 100% of this thing, they know that maybe like 10 to 20% is for upkeep. You need to be alive to do this grant. Then maybe 80% is for the research. But many persons will use 80% for
in this our area.
Yes, and then use 20%. It will not be sufficient. So at the end, they won't even get. I will tell you about one research in Jos that took years. I don't know whether they've closed the research. I think it's in Bukuru Metropolis. They got the grant to know where mosquitoes perch during the day. By the time I learned about it, it has gotten for some years and they couldn't come out with anything. Now, sometimes it's, research is evidence-based. So you may just think that it's perching outside or somewhere, but you have to prove it. So that if we know the particular place they perch, then we know where to attack when we are controlling them at this particular point in time in the day. This is where do you understand? But nothing. So sometimes you don't really see their fault out there. No. There are grants there. One is either we don't know how to make proposal for the grant. Secondly, people who have gone ahead of us have spoiled this thing. They've eaten the money and know. So the best thing to do once you get a grant is to hire a financial manager. You start writing down and doing all the plans and everything of every dime you use. Once you finish that grant and can present your paper, that's the open door for you to get more grants. But people don't think like that. They want to just, because it comes in huge amount of money. It's not just pebbles they give you. You understand? Because research could go through years. Look at this research of this thing she did now. She started from around 2005 gradually till 2022. That's how many years? That's a long time. So imagine she got a grant since then. It's a huge amount of money. But so many people, that's when they want to build their houses, get cars, do all
from grants money.
Yeah, before they now start thinking of the research. And before you know, nothing serious will come out. So such a person cannot go back to look for another grant for anything.
Because no evidence from the first one where they
Yes, and once that same institute gets a grant proposal from that community or area, someone has already tarnished that record. So they find it difficult to even release the grant. And then most of us, even as doctors, you see how there are complaints all around. There is no good facility to work. The pay is not, the compensation also is not adequate. There are lots of things going on. So who even has the mind to calm down and want to do any research? People are looking for ways to just go to better. Do you understand? To find greener pasture.
Exactly.
Those are the issues. Yeah, so those are the issues.
The Maslow law. Most people still stay down. Nobody get the time so they go but they find anything because now hunger now we want overcome. So if doctor they hungry, nurse the teacher they hungry. So say what you go happen to the woman where they get belly?
And you see again, sorry for cutting
No
you.
problem,
You see
doctor.
our own the community, the records we've had previously, like expired things, fake products, and all.
Yes.
You could see what justifies what our senior colleagues were telling us that time. If they don't get what they were expecting, they just tag it as this may be a bad product or expired product. But if we knew that our products are qualitative and this thing is not there, it should bring cause for alarm. Like, why is this particular? I've seen 2 people without ketones. I've seen 3 people without ketones. But nobody think of that. It's your expired. Listen, go and bring another. If it's not, it's a fake product. That we continue to manage, but it's dangerous because their causes, the underlying causes are different. The
treatment is different. You are treating somebody who the treat person will be say diabetes now because of hunger. You treat her like person who get soldier for inside country where they destroy. These are 2 different things of that side.
You see, now I get a question. I know this.
No.
This type 5 diabetes, you get cure.
Okay, so that's a very good question. So for now, there's still work going on because it's a new, it's an evolving field, right? It's an evolving field. Based on some of the records out there already, it could be managed to a greater extent. And one of the first things is nutritional rehabilitation.
Nutritional rehabilitation.
You have to start giving this child good amounts of
food.
Yes, nutrition. The protein is there, the carbohydrate is there, even the micronutrients, yes, and all that, so that this organ can start picking up
gradually.
And if it picks up well, that's why to start clearing the glucose, and that's all.
I may not vessel. See, I ask you this question for vision. Because for this field when I did inside, I be special educator, can be autism specialist, and part of the interventions for autism. Nutrition. So maybe they do some kind of scans and they will fit discover or some kind of tests. They will fit discover say, Kai, this pikin they lack maybe magnesium, they lack zinc, they lack waiting, and now waiting feed the affecting ability to learn thing, ability to feel regulating emotions, to feed maybe you can't get sensory issues, and we don't get results. We be saying after periods of supplementation or they don't see dietitian, they don't create new protocol for the pikin. Don't begin see better improvements. Don't see differences here and there. So now another thing I want to ask inside the same cure line, now saying you get age limits. Maybe say if you don't knock this particular age, your own don't do well. or maybe because we know say most times for this field, and I know if you speak for on our way the inside medical field, but they say early intervention now, like as much as possible, but for this type 5 diabetes, you get age where we say if you don't reach that age, it go hard to feel invest on things or
okay. Very, very important points. Let me just say 1 or 2 things in the first point you made about like autism, learning disability. One reason, have you asked why they get issues with some nutrients sometimes? Have you thought of that?
Yeah.
Okay, yeah. So because some of them, their diets, they are just particular things they want to eat.
Yeah.
They don't want these other things, and they lack nutrients that are contained in those things. And also with this mental health, mental health is evolving. Their research gastroenterologists have made that they found some organism in the gut preventing the absorption of particular things that affects the brain. Do you understand? So things are evolving over time. Now, as I said, this our type 5 diabetes, it's a new ground entirely. And you have to learn over time. There are some prospective research that will take place. They may get particular people and watch them over the years and see the outcome. Maybe they may intervene or not, depending on the type of research or what they are looking at for, right? But you see, in the development of pancreas, there's a peak period. Anything from, I think, adolescent to about 40, that's like the peak period. It starts declining, and that's where diabetes type 4 comes into play, what we call the mild age-related diabetes.
Oh, now be the type 4.
Yes,
Because I
do you
don't know that
understand?
one too.
Do you
You don't
understand?
hear that one too,
So
eh?
Yeah,
they are
no,
still
no.
using it like a research time and all, so that by the time you're around 40 going towards 60, the pancreas begin to reduce, deplete, those cells begin to atrophy, die off gradually. So the sugar control start going down. You understand? So if within that period of still where the pancreas still have that potential to grow, if you're able to rehabilitate, you intervene, then you'll be able to sort things out. You understand? But once you pass that other age, that if you are still alive, because the unfortunate thing is that once that diagnosis is not made and you were mad, like you were misdiagnosed, and most of the patients die. Because let me give you an instance. A patient with malnutrition related diabetes comes in and you diagnose as type 1 diabetes because it's similar to it. Type 1 diabetes, they come lean most of the time. They come in young age, right? And they could come in coma. The same thing the
type 5.
Yes, type 5. Now you now come like our own this thing. We check no ketones and all. You just say it's ketone. Sorry, it's DKA. You now start treating. When you give them insulin, what should have treated the normal DKA patient?
It will worsen it.
It will kill the malnutrition.
Because the sugar not even there.
Yes, because that one, he has receptors that are charged. You know, it's small insulin that he produces. They produce it rather, right? So the receptors are very sensitive, so that small is a way of compensation, so that the small insulin, they will respond to it maximally to mop up sugar. So imagine giving that kind of person a dose of insulin. They will hyperwork and they will bring down the sugar level to, do you understand?
Too fast.
The sugar will not even sugar. You will go into hypoglycemia and can pass. Hypoglycemia kills faster than hyperglycemia.
Hypoglycemia now when sugar
goes down, so the brain does not have sugar. All those things in the brain will switch off. And most times they will now target that is complication of DKA that kills the patient. You know, so that's how important it is. So because there are guidelines now, they've not brought out the whole criteria and the treatment guidelines, but there are things on ground at least. Because when you make this diagnosis, first things first, we know that you have to rehabilitate this patient nutritionally. Then there are some parameters, C peptides and other things, some particular investigations you do that will help you make a choice of treatment option. Okay, should I give a little of insulin to this patient to augment, or should I go with tablets, oral antidiabetic, because they all work differently, or should I even combine both of them? Because the insulin, what it does is that it just come up and start mopping up the sugar. There's no tablet for insulin; it's all injection. It just goes then into the blood and then mop up. But the tablets, some of them, how they function is that they reduce absorption of glucose from the intestine. Some of them suppress appetite so that you don't want to eat. Some of them, they help to stimulate the pancreas to work better by secreting insulin and other things to become, for receptors to become sensitive to insulin as well. So there are different parameters. So once you make that diagnosis and you are sure this is malnutrition related, the treatment option changes entirely. You understand? If not, many patients have lost their lives
because they make mistakes to know what they happen to them.
And now it's been proposed that there are about 20 to 25 million people with this malnutrition. But it's more than that. That's just because, in Africa, we have paucity of this. So we don't do research. So we don't. It will surprise you that even in Jos today, if you go and ask how many teachers we have, they can't give you a number. We don't have data. Do you understand what I mean? The same thing. We can't really point out because we are just knowing it now. So we've not even done research to know how many number of people. So it's an extrapolation. But even at that, so when you are extrapolating that we have about 25 million, let's take for instance Nigeria alone, right? With about 200 million. And then we are comparing with 25. There are over 50 million people in abject poverty. And this is poverty cause. This is hunger. Malnutrition cause. So it's not like it's purely genetics.
No, it's malnutrition cause.
It's based on our exposure.
Yes.
Because we don't have. So that's why it's happening. It's not like malaria. Once that infected female anopheles bites you and then releases sporozoites, you have the malaria. There's no two way about it. It begins to. Do you understand? So that's it. This individuals are exposed to hunger, chronic hunger, no nutrient, and also some practices, traditional practices. You know, there are some traditional practices that affect health.
Yeah.
Let me give you an instance. Like in the north, a child growing up, they don't give them egg, they don't give them meat, they don't give them this protein because they believe they will grow and start stealing.
Oh,
Do you
Never heard that
understand?
before.
So it begins to affect. Look at the one we do female genital mutilation,
yeah.
right? There are so many other practices apart from poverty itself that could affect. So imagine those kind of people. So they are only on staple food of carbohydrate, no protein at all, so that they don't grow and steal. You understand? So those are issues. So which means that 25 million they are saying is a fraction of what? Okay, look at India alone. India, there are more than 100 million people that are in abject poverty. So only that India alone should bring out 25 million people with something like this.
They're just playing it safe till they're able to get the accurate, something close to the accurate.
So those are the issues. But it's a very important thing.
We go do masterclass for this thing.
I'm telling you.
We do beginner, we do intermediate
I'm telling you,
session.
so that everybody go understand. And we go write out the topics we go cover. So that we go just stay with them. Doctor go explain because this one is a whole lecture session.
So that's why there's what we call preconception counseling. Before a woman takes in, as they are planning to take in, they are supposed to see their gynecologist. So the gynecologist will now decide, okay, start on these supplements, maybe folic acid, fesolate, and all these things, depending on their peculiarity. Then they help them so that you have enough store of these micronutrients
inside you.
Yes, I like this doctor. He's
You
a very ideal man. On that
And your
idea.
Very thorough. You will cover everything.
Now you see.
I got photograph and camera don't they tell us the time, don't
Yeah, we're rounding up now. So you see something I will commend Igbo people and sometimes yes, Yoruba people that once they give birth, you know, this pepper soup, these so many things they take to replenish most of those things they've depleted during the pregnancy and delivery.
The baby will take it from
And you
the
know,
breast.
most times they take in immediately again. But by that time, there's adequate nutrients.
Most
So
of them take
they
it
give
immediately.
birth to mostly healthy babies, sometimes
Yeah.
even overweight and all that,
Yeah.
because they have adequate this thing and they eat well during pregnancy.
They eat, oh.
Do you understand? Most times their babies even come out with hypoglycemia. Yes.
Okay.
You give birth, you see this baby very big, you come, you check blood sugar, it has gone very low because the baby is exposed to a lot of food, so his insulin is overworking. So it will clear. Once you release the baby from the mother, you keep it like an hour or two, the baby is going to hypoglycemia. And some of them will be crying until you start giving them
food.
Yes, food or water with this in glucose.
So they will cry fast because they are hungry.
They are hungry. And they will come out just the breast. When you put them on the breast, they start sucking
immediately because they have too much strength.
Yes. They are very, very
healthy
and healthy. So it's very important that we should also see to nutritional aspects of either women coming for antenatal or women planning for this thing. So the government can intervene in something.
That's the
like
government.
Yes. So that would be like a primordial prevention because we have primordial, primary, secondary, tertiary, and then with this thing.
So primordial is that before the primary.
So before it even happens, let the government policy and other things take on. It's not like sanitation, it's primordial for infectious disease prevention. You understand? Before you even talk about
he does the carry us.
No, carry us. As we don't finish now, you will just sign and put our name on top.
I am telling you, because they carry us go everywhere with all the grammar.
Thank you.
Dr. Kipto, thank you so much.
Yeah,
We let know.
so much.
I mean,
I'm sure our people
our
don't
people, we go stop this talk now because our doctor not ready to stop. Me, I want to hear more, but not go fit back. No go fit use 10 hours now.
Yeah.
When I say go tired to watch am, no one make una tire. So our doctor will come back again because plenty things dey where you don't talk now. What we want make everybody understand because as you know, we connect like this. Mama connects to a pikin, husband connects to a wife, and even after the pikin don't come, everything what they do, they affect each other.
Yeah.
You know? So at the end of the day, we need to know how to take care of ourselves and take care of the baby and take care of even the siblings. Because sometimes you tire and you want cook food, you cook one food for everybody, and maybe don't be the kind of food where everybody's supposed to be chop. Maybe some supposed to be chop up, like the mama now, for example, because the pikin go take from your breast milk, you know. So sometimes women when they get better, not say good food no day house, but they not just feel like eating. So as women will get better now, it no matter whether you like them or you not like them, because your food that medicine for your pikin for cycle. Abi? Because they say poverty now. This poverty not be only saying they not get money to buy. Poverty if it happen because you dey picky, too picky during pregnancy. You get the money to buy, but you no hungry you. You go chop food when no go benefit your pikin for 9 months. Then when you born the pikin will come get developmental disability and learning disability because nutrients not doing body. But the pikin go take off. So you get money, but you take your money, take a buy poverty for your pikin, take a buy problem. I be alive, doctor.
Yes. Sure. It's time. I would have said one thing very important you made mention of.
Quickly.
So like in pregnancy, you know, there's something we call pica, where a woman craves for unusual things. Yes, like strong.
Yes.
Do you understand? Most times when you see someone having pica, it's because their blood level is low. So it's the body trying to bring in something to help. So that pica, like that stone they keep eating, it has a lot of iron.
Okay, that's
so that it will help build blood.
Yes.
You understand? It's not only in pregnant women. Now, there are conditions where excessive iron in the body, maybe a pregnant woman takes and circulates in the blood, can affect even the baby.
So if the later one you chop, like if it could be problem for you and your
yes, even in adulthood, excessive iron, there are two things we call hemosiderosis, hemochromatosis, is a cause of type 3 diabetes, type 3C diabetes, where iron accumulates a lot in the pancreas and destroys it. So once it destroys it, no more insulin. The same thing, alcohol, you take a lot of alcohol, chronic alcohol, it destroys the pancreas, chronic pancreatitis, it stops producing insulin, you go into diabetes. There are lots of infectious diseases doing that, cancer itself. So there are categories in that type 3C diabetes. There are lots of things that will cause.
See why you know if you do medical school online. You don't be the online.
We go as well, we don't go. I will go house. My people will go house. We will continue this story. We will get part 2 of this topic because I mean, all of us must learn this one. Dr. Kinto, you do well. Thank you so much. I beg, with our people.
Thank you so much. Thank you for watching. Thank you for your time. We hope you use what you've learned for now and then for the future.
Yes, and I
also
beg,
tell others, let them watch, also preach to them, and then let them know. You know, knowledge is power, so that they overcome these beasts of the thing. And let's have it all. Even the medical personnel, let them go into research as well, and then get themselves exposed to some of these conferences where new things come up. Then it will translate to better outcome when they come to treating their patients and all. Thank you so much.
Thank you.
My people, wanna share, give every other person with them around them. Wanna not keep this knowledge to ourselves, alone, so that all of us will grow. We need all of this information. Now health, now wealth. If you like to get money, we'll full inside your room. If you know well, your money now waste. To make God not let us waste our money.
Better people. Wanna rest well, eh? Bye bye.